Hi everyone, we just wanted to sit and do a video update with you guys just about what's going on, about the GoFundMe, and to just really show our appreciation for all this has done for us and all this has taken off of our plates. As you guys know, it's been a really long journey. We've had a lot of financial struggles along the way for so many reasons, but mostly from Marcus having to stay home a lot on my sickest days, especially this last year because of the progression of this. This last year has been the absolute worst. Just going to countless doctors, trying to find answers. So finally getting to this point has been a relief, and deciding to do the GoFundMe, we're really glad we did because it's really taken off so much stress from our plates. I had a lot of supplies I needed. I had a lot of doctor's appointments here in town I needed to see, and the Cushing's has caused a lot of problems with pretty much every system in my body. So it's helping us with all of that. I've been able to get most of my pre-op items now, or not my pre-op, my surgical items that I need for recovery, my pre-op appointment and my post-op appointment with my endocrinologist that I see over telehealth. And we're slowly just getting everything booked. Everything's pretty much ready for the trip. We leave in, we leave in 2 weeks. 2 weeks tomorrow, and surgery is, pretty soon after that. So it's all happening really fast, but we are just so grateful for each and every one of you, whether it's been $10 or more. Every little bit helps us, and we have so much gratitude to every amount that everybody has donated to us, because the rest of the funds will go to future medical care, because it's such a big question mark at this point. We don't know what's going to happen after surgery. So much could happen. So anything that I need, I might need physical therapy for some time after surgery. I'll still obviously have many, many doctor's appointments, so that's all going to cover that. So any money that has not been spent already is going to go to the future care of anything that could happen. And so we're hoping for the best, preparing for all possibilities, but just thank you guys so much from the bottom of our heart. There have been a lot of family, friends, a lot of people that we don't even know, which is just so touching to us. So thank you guys for that.
Yeah, it's not even necessarily about the amounts that you guys give. Like she said, whether it's 10, 50, 100, whatever it is at a time. Um, it's more the choice that you guys have made to support us in any way you can, whether it's easy on you or hard on you. It's nice to know that people are there, that want Victoria to get better, that want us as a family to do better. Um, and I know this is a way for those people who aren't necessarily in our lives or around us all the time, or even just acquaintances, gives you guys a chance to support us in a way that's kind of easier for some people. But I do know these financial times are a little bit harder on people also. So, and they are for us as well. And it means that much more that you guys are stepping up to do this. I'm really looking forward to Victoria having the chance to recover and get better from everything she's going on. Ever since I met her, she's struggled basically with Cushing's, and maybe it hasn't been as strong, or it's kind of really hit her harder this past year. Um, Affected her time with her kids, with me, even just with herself. Every part of her life has been affected, and I want to see her just be able to live her life, be able to enjoy those times with her kids, with as a family, enjoy functions, anything. It's been a really long path. It is still going to be a long path for her because it's not just a quick operation where you're operated on and you're rehabbed and you're good to go. It's a lot of unknowns for us still. It already has been, and now it's just more.
Yeah.
But doesn't mean we're not gonna. So it doesn't mean Victoria's not gonna go into that as strong as she can. Um, she will also continue fighting. If anything, that's also what this GoFundMe has done, is kind of given her a breath of life to fight, to to be there for herself, and to really keep pushing. So yeah, yeah,
Yeah, we've been drowning for a long time, and back when the symptoms started, obviously I had no clue. I had no clue what this would end up being, but since I met Marcus, I had already been having health issues crop up that just no one really had any answers to, and just weird stuff was happening with like my immune system, weight gain, my sleep was already deteriorating, my mental health, just anxiety, depression, um, which I've had a lot of diagnoses along the way. That were like steps to getting closer, but never the full answer. And um, I really, we don't even have enough time to sit here and explain all the ways that Cushing's affects me and affects our life and our family and our kids, and how it has affected us. It's been a nightmare. It's been I can't put it into words. And the time of year that all this is falling on has been difficult. It's the holidays, and we just have even more appreciation for you guys donating, because we know times are hard. It's the holidays, and everybody has their own loved ones to get gifts for. So the people that have donated, just thank you so much for that. We don't take it lightly, and we realize the time of year that it is. So thank you for that. And we just wanted to update you a little bit about what we've been up to. Um, so obviously we've been making our preparations. I mentioned NORD, the National Organization for Rare Disorders, in in my post, but they're helping us with some surgery costs, hotel accommodations, and the flights for Marcus and I. We had someone very kind donate the flights for our kids going there. They're going to drive back with their grandparents, headed back home.
mm-hmm.
But we've been just getting all the details in order for all of that. I've also had some more medical issues crop up unexpectedly, so we've had to deal with that. My my cortisol goes from high to low. When it's low, I take hydrocortisone to avoid adrenal crisis, especially now that I'm on cortisol lowering meds. So since it fluctuates, I could accidentally take meds when I'm already low, and it could put me into a crisis. So I have the meds for that. I had a situation where I was about to have a crisis again. I really wanted to avoid the hospital because, well, I just don't like hospitals. I don't want to be there more than I have to. And I was just in the hospital for adrenal crisis a couple months ago. So I didn't want to do it again. And the medication really upset my stomach. I had to take a lot of steroids on an empty stomach. And have been having GI issues from this that have been developing over the last couple of years that I never had before. Um, Ended up having to do an endoscope. They did biopsies, stuff like that. So that was just thrown into the chaos of everything that's going on now. But we got that all sorted. I have gastritis. The medication does upset the stomach, so I'm being really careful to take it with food and stuff now. And hopefully I just won't have to deal with it again until surgery. But so yeah, that's been happening. Just normal holiday stuff. Our son Roman's had a bunch of Christmas stuff going on at school. Trying to do our normal family Christmas stuff and try to give the kids a semi-normal Christmas. But of course, the last day of school, Roman gets sick. Then Cairo got sick the next day. Then I got sick the next day. But we were still able to travel to Hereford, where we go for my mom's side of the family, and so we did that, and just trying to get the rest of my supplies squared away. My pre-op appointment had to get changed. We're doing a bunch of stuff for insurance, paperwork, just all that stuff. So it's been a lot going on. Yeah, but you guys have helped so much already.
Absolutely.
I have all the things that I need, and I will soon with all, I'm going to need just like the nasal rinses, all this stuff to help me, like shower chair, a cane. I'm going to have a lot of weakness and um, just a lot of dizziness, lightheadedness. So all that stuff's going to help me recover comfortably, and knowing I already have that and we didn't have to dig into our, very sparse funds that we have, I can't even explain how much that takes from us. So thank you guys so much. And
Yeah.
knowing that we have some money to go towards everything, all the unknowns after surgery, just takes a load off, because it has been just so stressful. I mean, everything about this has been stressful, but having some financial stress taken away has helped so much, and I'm able to focus my attention on everything else that needs to be done. So we're forever grateful, really.
Absolutely. Yeah. I second that as well. Like I said, there's so many things that are unknown, and so many things that after her surgery are follow-on stuff. Like basically, this disease has affected every part of her body, and every system in her body, and
My sleep, my
yeah,
hormones, my heart, I have tachycardia, my blood pressure. Um, Somehow my blood sugar is still okay, but definitely have some like
yeah,
insulin resistance going on. I already touched on the GI issues. You know, it's given me like I have eczema now. I never had eczema before, and some skin problems. And I suspect some autoimmune stuff that I'm going to the doctor for soon. And even like my teeth, it's caused dry mouth, some of the medications too. Um, but like my teeth feel like they've been crumbling. I have a cavity for the first time since I was young, and just everything, just all this stuff. It's like my whole body is just falling apart. So
yeah,
it's
and
a lot.
there's so much more even after the surgery we have to wait and see on. Hopefully, what we're hoping for is that she comes kind of crashing down from that high cortisol after surgery, and her body wakes up from there. But after all that is when we'll hopefully find out more about any other damage
We should know
going
like
on.
relatively quickly after surgery if it's successful, especially when they do the biopsy, but they're going to be monitoring my cortisol levels to see if it's successful, because if it is successful, like you said, it should crash. So I will be steroid dependent for X amount of time also, which I can't stand, but I don't like being, dependent on something every day, but it's going to be much better to be at that spot than to be where I'm at now. So that's what we're hoping for. It'll be another learning curve for us afterwards, because a lot of things can, when you have adrenal insufficiency, a lot of things can put um, your life at risk, basically. Getting sick, getting a cold can deplete your cortisol, emotional stress, just anything.
Stress period, yeah.
Even like traveling can do it. So we're trying to learn all of that ahead of time, know when to updose. And I'm still trying to find an endocrinologist here in Lubbock that can help with the process, but I'll still probably be seeing my one over telehealth. It's just being out of pocket, it's so expensive. And if I have an emergency situation, I'm trying to have a doctor here, but I have a good PCP who I just found out is leaving, so I'm gonna be looking for a new PCP too. Um, but we're learning how to do, how to manage all those situations after, and hopefully, um, they will start the weaning process to have my body wake up, and I won't eventually be able to stop taking steroids, is the hope. And this is all if the surgery is successful. So, um, lots of unknowns. I've had a lot of, muscle weakness and posture problems, pelvic floor stuff. Just I've lost a lot of muscle and the ability to work out, except for chasing the kids and doing stuff around the house when I can. But yeah, right now we have been also preparing our house. Like it got a mess after having Cairo, really, because that's once I weaned from weaned him from breastfeeding, my Cushing's problems really just went into overdrive. And so we got behind on the house, and we're trying to purge, deep clean, have everything just be reset again so that it's nice after surgery and we won't have to focus as much on that. So on the good days that I take advantage to help Marcus do all that and trying to do that. And then just trying to spend time with the kids right now because I just don't know what's coming, you know? That's the scariest part of this. But